Hello and welcome students. I, Dr. Adil Patel, welcomes you for the discussion of the topic two compartment open model. So let us try to understand what is the concept of two compartment open model. So many drugs given in a single intravenous bolus dose demonstrate a plasma level time curve that does not decline as a single exponential, which is also known as the first order process. Now the plasma level time curve for a drug that follows a two compartment model shows that the plasma drug concentration declines by exponentially as the sum of two first order processes, that is distribution and elimination. A drug that follows the pharmacokinetics of a two compartment model does not equilibrate rapidly throughout the body as is assumed for a one compartment model. In this model, the drug distributes into two compartments, the central compartment and the tissue or peripheral compartment. The central compartment represents the blood, extracellular fluid, and highly perfused tissues. The drug distributes rapidly and uniformly in the central compartment. A second compartment, known as the tissue or peripheral compartment, contains tissues in which the drug equilibrates more slowly. The drug transfer between the two compartments is assumed to take place by first order process. In this particular graphic or figure, you can see a graph of plasma level drug concentration versus time, and this particular graph represents the curve for the two compartment open model, that is the data collected followed by the single IV dose. And as you can see here that the decrease in plasma level concentration is not uni-exponential but it is bi-exponential. So there are two different processes which are responsible for the decrease in plasma level concentration. The first one is the distribution phase and the second one is the elimination phase. Two compartments are designed or divided or decided on the basis of blood perfusion to particular organs or tissues. So organs and tissues with large quantity of blood capillaries and blood vessels or which are highly perfused are called the central compartment, which includes the systemic circulation as well, and tissues and organs which are having less blood flow and which are less perfused with blood are considered as the tissue compartment or the peripheral compartment. Now there are several possible two compartment models. Model A is used most often and describes the plasma level time curve. By convention, compartment 1 is the central compartment and compartment 2 is the tissue compartment. Now the rate constant K12 and K21 represents the first order rate transfer constant for the movement of drug from compartment 1 to compartment 2, that is K12, and from compartment 2 to compartment 1. So the movement of drug between the compartment 1 and 2 is reversible. So initially the drug may go from compartment 1 to compartment 2, and after certain period of time the reverse of this thing is observed, that the drug may re-enter into compartment 1 from compartment 2. The transfer constants are sometimes termed microconstants and their values cannot be estimated directly. So all this movement of drug is happening at a very minuscule level in the body. So sometimes it becomes very difficult for us to estimate the rate constant's value. Now, most two compartment models assume that elimination occurs from the central compartment model as shown in model A unless other information about the drug is known. So, mostly the elimination of drug is taking place from the central compartment that has been assumed while writing the hypothesis of two compartment model. The drug elimination is presumed to occur from the central compartment because the major site of drug elimination, that is renal excretion and hepatic drug metabolism, occurs in organs such as kidney and liver, which are highly perfused with blood. So both kidneys and liver are part of central compartment because of very rich blood circulation. So as you can see here that model A depicts the movement of drug between central compartment and the tissue compartment. So drug may enter from the central compartment to the tissue compartment, and from tissue compartment it will re-enter into the central compartment. The major point in model A assumption is that the elimination of drug is taking place from the central compartment. When we are discussing model B, so the underlying principle is same, that there is a central compartment and tissue compartment, and the drug movement is happening between these two compartments. But in compared to model A, here the elimination occurs from the tissue compartment. The third scenario is a model C, in which we are presuming that the excretion or the elimination of drug is happening from both central as well as the tissue compartment. Now the two compartment model assumes that at T is equal to 0, no drug is in the tissue compartment. So when you are giving IV injection, there is no amount of drug present in the tissue because the distribution of drug has not started. After an IV bolus injection, drug equilibrates rapidly in the central compartment. The distribution phase of the curve represents the initial more rapid decline of drug from the central compartment into the tissue compartment. Although drug elimination and distribution occurs concurrently during the distribution phase, there is a net transfer of drug from the central compartment to the tissue compartment. The fraction of drug in the tissue compartment during the distribution phase increases up to a maximum in a given tissue, whose value may be greater or less than the plasma drug concentration. So all these scenarios or assumption you have to remember when you are describing about the two model open compartment system, in which we have one central compartment and one peripheral compartment. At maximum tissue concentration, the rate of drug entry into the tissue equals the rate of drug exit from the tissue. So there is a equilibrium state. The fraction of drug in the tissue compartment is now in equilibrium with the fraction of drug in the central compartment, and the drug concentration in both the central and tissue compartments decline in parallel and more slowly compared to the distribution phase. So after certain period of time, there is a equilibrium in terms of drug concentration between the central compartment and the peripheral compartment. Now this decline in a first order process and is called the elimination phase or the beta phase. Since plasma and tissue concentrations decline in parallel, plasma drug concentrations provide some indication of the concentration of drug in the tissue. At this particular point, drug kinetics appear to follow a one compartment model in which the drug elimination is a first order process described by B, that is also known as the beta. So when combinedly you are studying the behavior of central compartment and the peripheral compartment, it is called as a two compartment model. But when you study the behavior of drug in individual compartment, it follows the one compartment model, right? So if you study only the central compartment and the behavior of drug in central compartment, then it becomes the one compartment model. If you study the peripheral compartment and the behavior of drug into peripheral compartment only, then it becomes one compartment model. But when you study both these together, it becomes two compartment model. Now let us try to understand the volume of the central compartment. So the volume of the central compartment is generally greater than 3 liter, which is the volume of the plasma fluid for an average adult. For many polar drugs, an initial volume of 7 to 10 liter may be interpreted as a rapid drug distribution within the plasma and some extracellular fluid. For example, the volume of peripheral compartment of moxalactam ranges from 0.2 to 0.15 liter per kg, corresponding to about 8.4 to 10.5 liter for typical 70 kg patient. In contrast, Vp of hydromorphine or morphine is about 24 liter, possibly because of its rapid exit from the plasma into tissue even during the initial phase. What is the role of apparent volume of distribution at steady state? So at steady state condition, the rate of drug entry into the tissue compartment from the central compartment is equal to the rate of drug exit from the tissue compartment into the central compartment. The total amount of drug in the body at steady state is equal to the sum of the amount of drug in the tissue compartment, that is the dt, and the amount of drug in the central compartment, that is the dp. Therefore, the apparent volume of drug at steady state, that is VDSS, may be calculated by dividing the total amount of drug in the body by the concentration of drug in the central compartment at steady state. So this figure would help you to understand the relationship between the tissue and plasma drug concentration for two compartment open model. The maximum tissue drug concentration may be greater or less than the plasma drug concentration. So dear students, that was all about the two compartment open model followed by the IV bolus administration. Please go through this video, and if you have any query or question, please let me know. I would be happy to answer your queries. So thank you very much for watching this video. Have a good day and stay safe.